Senator from Ohio.
Thank you, Mr. President. I appreciate the always good insight from the senior senator from Oregon, my colleague in the Finance Committee. Thank you, Senator Wyden. Mr. President, I first ask unanimous consent that Natalie Kurelichin and Elizabeth Wagner, fellows with the Health, Education, Labor, and Pensions Committee, be granted floor privileges through the end of next month, July 2016.
Without objection.
Thank you, Mr. President. Today, the Supreme Court, despite lacking an important ninth justice, because my Republican colleagues refused to do their jobs, first time than anybody can remember, maybe in history, certainly in recent history, where a Supreme Court nominee has been sent to the Senate by a president, and the president's refused to do either hearings or certainly refused to bring that justice to a vote. It will, if this continues, if Senator McConnell and his Republican colleagues continue their course, this will be the first time in 150 years where a Supreme Court vacancy has stayed open for an entire year. Why 150 years ago? Well, because we're in the middle of a civil war, and there were all kinds of things going on as Southerners who had seceded left the Supreme Court with lots of vacancies, and the Senate didn't do its job then, but that was a civil war. This is a political war waged by one side and a refusal to do its job. But today, the Supreme Court, despite not having 9 members, reaffirmed that women, not politicians, should be the ones making their own health care decisions. In a 5-3 decision, the Supreme Court ruled in Whole Woman's Health versus Hellerstedt that the Texas law at issue places an undue burden on a woman's ability to access safe and legal health care. The law's arbitrary, medically unnecessary restrictions caused dozens of clinics to close across the state of Texas. The same thing has happened in other states with similar laws, including my state of Ohio with 11 million people. These clinics are often the only place that women and also many men have to turn to for basic health services. Today's decision is a victory for health care in Texas and ultimately state after state across the country, we hope. Millions of women rely on Planned Parenthood and other clinics like it for life-saving screenings, for testing, for preventive care, for treatment. In Ohio, Planned Parenthood centers provide health care services to almost 100,000 men and women each year. 100,000 men and women depend on Planned Parenthood, again, for things like screenings, testing, preventive care, and treatment. Many of these men and women have nowhere else to turn. They either cannot afford care anywhere else, or they live too far away from another health center to have real access to basic health care, screenings, testing, preventive care, counseling, treatment, all those things. Today's decision sets an important precedent that no politician should come between a woman and the health care she needs. We know that laws like this are part of a sustained, coordinated attack on a woman's right to make personal, private health care decisions for themselves. We've seen it in Ohio, we've seen it in so many states across the country. Politicians claim these harmful restrictions are all about protecting women's health. Nothing could be further from the truth. These talking points are a sham, and it was shown today by a generally conservative Supreme Court with a majority decision that the Supreme Court saw right through those arguments. Ohio and other states with so-called trap laws should repeal them immediately. If they wait, they'll only be struck down by the courts, just like the Texas law. Again, courts where most of those justices, or at least half those justices, were appointed by conservative presidents. We need to work to get these laws off the books quickly to fight the attacks that women continue to face on their right to make their own health care decisions. Earlier this year, Ohio passed a new law to strip federal funding, not only from Planned Parenthood, but any health care facility that could be perceived as promoting, quote unquote, safe and legal abortion. This includes health clinics that simply work with other providers to refer women to other facilities so that women can make decisions that should be between them and their doctors. This is far, far more sweeping than just defunding Planned Parenthood, which is a political talking point for Republicans across this country now. Health officials in Ohio are scared the new law could take funding away from local health departments, as if we don't have enough problems in our state. Let's be clear, this isn't about defunding abortion. The federal government does not provide funding for abortion, period. It hasn't provided funding for abortion for decades. No, this Ohio law explicitly targets critical health and health education services for women, including HIV testing and cancer prevention services. Today's verdict by the Supreme Court, 5-3, is a victory for all of us who want to improve the lives and health of women around the country, but it will do nothing to stop laws like this one in Ohio. That's why our work goes on. These laws that have passed in Texas and Ohio, these laws that the court struck down, these laws are not about health or safety. The Supreme Court confirmed that today. They're about politicians thinking that they know better than women and their doctors, and it's happening every day in this country. If these laws continue to chip away, or in the case of Ohio's new law, carve away, a women's access to care, we'll see more undiagnosed cancers, we'll see more untreated illnesses, we'll see more unintended pregnancies. My state, Mr. President, shamefully is 50th in the nation in black infant mortality. We're 47th in the nation in overall infant mortality. It's laws like these legislators passed, laws defunding public health services, laws cutting money for local communities so they can put it into health care and education. It's the behavior of this legislature and some of its predecessor legislatures that have attacked young mothers and young women who may or may not be pregnant. And when you do that, there is simply not the emphasis on well baby care. There's not the emphasis on preventive care. There's not the emphasis on the health of the mother. There's not the emphasis on giving women choices. It's time for politicians in my state and across the country to follow the guidance of the Supreme Court today and to stay out of decisions that should be confidentially between a woman and her doctor. Mr. President, I note the absence of a quorum. No, I yield back my time.